Good afternoon, dear students. I don't know if you hearing me because it's time to start our lecture today. I will wait 5 minutes more if somebody came here. Today's lecture will be about X-ray examination. Hello everyone, hello, nice you are visiting us, and I hope you hear me clearly, and let me know please, and I am ready to start. Yeah, as I said, today's lecture is about X-ray anatomy and computed tomography of internal organs. We will talk about, yes, thank you. So this lecture, in this lecture we will talk about vessels, blood vessels also, and see mostly head, neck, chest, abdomen and pelvis parts of body, and refreshing our knowledge about organs and vessels as well. So let me switch off and open demonstration. Nice. Maybe you remember our previous lecture where we were talking about X-ray examination for organs movement system, about bones, joints, muscles, etc. Now it's time to talk about how internal organs are looked like in X-ray examination and other method of diagnosis or radiation research. We call them radiation research method, as you see here, and the modern medicine offers an impressive list of X-ray diagnostic method that allow not only to identify a wide range of diseases but also to promote their more effective treatment. Surely you have already met with various methods of X-ray diagnosis. We call in our country more usable the term Röntgen diagnosis. X-ray is the term for Western University, and the most commonly used array method are of course X-ray examination, call it also Röntgen examination. Fluorography, I hope you remember, that is a method to diagnose the chest organs, mostly lungs. Contrast radiography is used with combination injection, some kind of fluid which get and absorb X-ray radiation. Fluoroscopy, this is movie diagnostic, dynamic diagnostic with X-ray. CT scan and magnetic resonance imaging, these are modern method. Usually more and more this method are more and more used in clinic now. X-ray technique, I would like you remember just to remind you the technique of ordinary X-ray examination. Unlike visible light, X-ray pass through of the body, and the research object is placed between X-ray source and the receiver. Here is X-ray source and here is a receiver. When X-ray pass through the body, some of they are absorbed by the organs and hit the receiver. It means some of organs, mostly bones, are they are very good object absorbing X-ray examination, but the other X-ray come to the receiver. It may be electronic device, it may be also the special film and with argentum salts, and but mostly now it is device, not film. And this device transforms X-ray into electrical signals that are displayed on the screen. Previously, a film with the silver was very useful, but now I think nobody use silver films in clinic because it's long and not such useful for doctors. And X-ray examination is two-dimensional imaging. I hope you understand that is only image, three-dimensional object which is associated with the projection layering of various anatomical structure. So a lot of structure located in the body, they will be combine in the screen, and it requires from you certain skills to read and correctly interpret this image, because all of structure are in the same image. Well, next picture show you most internal organ absorb X-ray in very small rate, and to see an individual organ on a radiograph, we need to feel these organs like stomach here, and it is filled with the special radiopaque contrast substance. Mostly for hollow organs we use barium sulfate. This is a salt which is not diluted in the water, and it is good because barium is a metal combined with sulfate, and it absorb X-ray very good, so we are visible all of the parts of stomach mostly. And another way, we can inject some contrasting substances into the blood vessels, and some of these substances, some of this radio contrast fluid evacuate from the body by the rinse, by by the organs of urinary systems. And when it comes to the urine, it makes it visible, like kidneys, pelvis, ureters, and urinary bladder here. Another way to inject a special substance and fluid in the arteries, and like here it was injected in the femoral artery, right femoral artery and left femoral artery, and made these vessels visible. Next picture, I hope you remember it, that is a computed tomography. And this is of course a modified method of X-ray examination, but this is it is the special technique which used a lot of X-ray sources located around the body, and also a lot of receiver around the body, located here, here, and here. So when doctors start a CT scan, each sources send X-ray through the body, and it come to the receiver, and then computer analyzed the these signals and combine them into the picture we see here. This is the CT scan, and it looks like section through the body, and such section may be mostly in horizontal place, but a modern computer can also produce different sensitivity of the receiver, changing the sensitivity of the receivers of CT scan. We have opportunity to identify different anatomical structure from bones here and to the lungs. That is just it's adjusting by the sensitivity of the sensors and receivers. Here another advantage of the computer tomography, which use of many scans together and combine them and make it visible like three-dimensional object. Sometimes it is also combined with injection of blood vessels. Here artery, you see the carotid common artery injected with X-ray absorbing fluid, and makes visible arteries of the head and neck. And the more modern method of radiation examination is magnetic resonance imaging. We call it in abbreviature MRI, like magnetic resonance imaging. It was invented in the United States also, and usually it doesn't use the X-ray examination, just electromagnetic field. This field causes the polarization of hydrogen atom in the water molecule inside of our body, and when the electromagnetic field is turned off, each water molecule generates its own electromagnetic radiation, which is recorded by a computer. The same way, but the difference is that we could see more. It allows to see muscles and soft tissue better than by CT scan, and it is also possible to see the section not only in the horizontal place but in different place, with a frontal place and sagittal place. Usually doctors use CT scan when they need to examine bones and contrasted blood vessels, but they prefer MRI examination when they want to see soft tissue, muscles, skin, and internal organs. As you see, MRI computer can produce color images all of the body. Here is a man and here is a woman. I want to demonstrate you different images of the three radiation method we use in clinic. That is a banana. Here you see X-ray examination of banana, CT scan, and MRI image. As you see, when we look at the X-ray image here, we can hardly understand if it is a banana or cucumber. All right. There are more internal details on the CT scan image here. We see some internal structure, but not very clear. But the best way, the maximum numbers of structures are distinguishable by MRI examination. This is that is explain why MRI is becoming more and more popular for examination internal organs in clinic. Now, this is we follow to the X-ray examination, and next part of our lecture is X-ray examination anatomy or X-ray anatomy of the head and neck. Let's see the first image here. That is CT scan. I will use abbreviation. CT scan means computed tomography scan or image which was made in frontal section through the nasal cavity. And what do you see here? This is the first, this is nasal septum. Then we see three nasal concha, inferior, middle, and superior. Between conchas, we see the dark or black fissure, because that is a negative image. That is air which doesn't absorb X-ray, so it looks like shadow, but in positive it will be white. So this is all of meatus. Number 7 is inferior nasal meatus, that is middle and superior. Also, please take in consideration that is part of the sinus maxillaris. This is a hole in the maxilla, and also visible the structure orbitus, 2 orbitus, right and left. Usually such images, such examination, doctors use to diagnose the correct position of nasal septum, as well as to see the inflammation inside of humor sinus, or sometimes they try to find some tumors inside of nasal cavity, but that is mostly pathological process. Here you see normal, absolutely normal structure in the nasal cavity. Another method to see tooth position and diagnose dental orientation of all teeth, we can see by orthopantomography. Orthopantomography, I think this is a correct pronunciation. Usually this method is progressing by taking the sources. I will show you the sources receiver inside of the our mouth, and then around the head moves the sources of X-ray. It gets the plenty jaws, inferior and superior, as well as all of dentists located in these bones. Every teeth visible radix and other part of these organs. Mostly such examination uses by dentists when they examine patient firstly. Usually they take such common method called orthopantomography. When they need more details structures, they try target dental radiography. Especially they use different power of the X-ray, and see separated dents to examine their radius, column, and even cavity inside of the dens. Also, we can also nicely see the different tissue of the dens, like enamel here, and the dentine and pulp cavity. Pulp cavity is mostly look like duck cavity inside of the dens. Computed tomography of the oral cavity is taken in frontal, like here, frontal, and even sagittal section. We see here the glossum, or the lingua, the septum inside of lingua, hard palate here, the mandibular, two part, right, left and right, the gland, submandibular gland here, and even platysma. It is also visible. In sagittal section, there are hard and soft palates here, lingua as well, and some of muscles. This is mylohyoid muscles, and also sometimes we see the genioglossus muscles, but here is another projection, and we see only mandibula on this side. We also can distinguish the pharynx here. This is the upper part called nasal pharynx, nasopharynx. Here is the oral pharynx, and you remember this is the opening from oral cavity to the pharynx called phalthus here, and this is the inferior part of the pharynx called laryngopharynx. And also very good to see the air inside of larynx, because that is the organ which consists inside, which contains the air inside. Special possibility, dentists and surgeons have to examine salivary glands. Usually it is interesting to see the parotid glands here, and they inject fluid, radioactive fluid, radioabsorbing fluid inside of the ducts of the parotid glands through the opening in the oral cavity. You see the fluid which is also in the oral cavity, but some of fluid came into the ducts and show its structure. The same method with the injection of absorbing fluid is used by examination of submandibular gland, submandibular salivary gland here. Visible the duct of this gland and the body, the the organ under the mandibula. This is the orbital MRI showing you the orbit. Here is the globe of right eye. As you see, it is also horizontal section. We see the nerve, optic nerve, and at least we see two muscles, the medial and lateral rectus muscles here. Very good image here, especially for ophthalmologist. Take a look and here and see the zygomatic bones, and between globe and zygomatic bones you see number 4, that is lacrimal glands, which produce tears, fluid. Lateral, next part is the neck, and we see neck organs. Mostly we see the larynx here, and communication with pharynx. And then we see number 10 is the trachea, which is used for transporting air to the lungs. These hollow organs containing air inside doesn't need a special contrasting procedure, some injection, because air is also has the minimal radio absorbing feature for X-ray. So doctors doesn't need to inject some liquid inside of larynx or trachea. It's easy. Usually we didn't see the esophagus here because number it is here, but we couldn't see the inner structure in this organ because it is not contrasted. MRI of head and neck in horizontal section usually show us the nasal cavity, nasopharynx cavity and nasal cavity as well. Here is the septum, and some of the bones around the pharynx. This is the first vertebra called atlas, and we also see the muscles between muscles are located on the anterior surface of vertebral column, and we also see that is interesting, number 5 here. This is opening of the Eustachian tube, or another way, this is the vestibulum tube, is the special canal between middle ear. Another way, another name is tympanic cavity, and it is visible that this is a great communication or acoustic tube or Eustachian tube. That is necessary to change the pressure, air pressure inside of tympanic cavity, because it's has no connection with the external acoustic meatus, just only through the pharynx. Here this is another sagittal section of the neck and head, and we have already talked about it, but I could say this image is very good quality. Here you see the bones. Here is the number one is the thyroid cartilage. It is not bones, it is cartilage, but it is also very good contrasted in the horizontal section of the neck. In the position, I think it is this is fourth cervical vertebra. I think it is number 4. And please see here also some of the large blood vessels, like internal jugular vein here, and common carotid artery here. That is large vessels of the neck, and they are located right back to the large muscles called sternocleidomastoid muscles, sternocleidomastoid muscles here. Please see the pathological object here, number 15. This is the abscess. Abscess is the cavity which is filled with the pathological fluid which produced after inflammation, like just I checked the correct term. This is the pus inside of the sternocleid muscles, and the surgeon need to evacuate the pus out from the abscess. Next part of the body is chest, and we start with the frontal X-ray examination of the chest, and you can see different bones. I don't want to stop and explain the bones because we had special lecture. I will concentrate on the internal organ. First of all, I'd like to show you how the heart looks like in the frontal projection. This is the aorta here. It's visible. Then we see the superior vena cava. Then it is also vena cava here, and here is the border of the number 20 right atrium. Taking in consideration that we couldn't see the border of right ventricle because it is located down in inferior position, so the border is not visible because of the diaphragm. Left shade is the also number 7 pulmonary trunk. Number 5 is aortic arch, but number 7 is the pulmonary. It is pulmonary circulation. Then we see left atrium, especially this part called the appendage of the left atrium, and then we see the left ventricle. It is a typical normal position. Usually doctors try to see position by the special vector between the basic part of the heart and between the apex of the heart, and they evaluate the angle which is we can construct between the horizontal line and the vector and heart vector also. This is this angle show us position. It may be vertical position, horizontal position, or oblique position. I think here it is a oblique position, which is more typical for more people. Another interest is to see the lungs inside of the chest. Usually we see some of the shade, some of the structure located close to the mediastinum. As I think you guess, that is bronchs and large vessels, pulmonary veins and arteries coming into the lungs through the lungs radices. But another part of lungs is another parts of lungs are without of any structure. They are not visible on the fluoroscopy, so that is good and typical for normal lung tissue, and doctors are very glad when they didn't see some inflammation or some of the shadow signaling us about pathological process in the lungs. Here, this is a lateral projection of chest X-ray examination. We also see the heart here and different part of heart, and we see upper part of the lungs and the inferior lobes of the lungs. You should remember that this projection of the two lungs, and we see structure combined in the one place, but they belong to right and left lungs in the same place. We see all structure layered in the one place of X-ray imaging. Very often doctors try to evaluate contours of the bronchs, heart and blood vessels, and it is easy when you know such location of the green is trachea and bronchs, main bronchs, and they are filled with air and visible. But blue objects is lungs vessels which filled with blood, and they are also visible. Experienced doctor can see even some pathological process in the bronchs because they examine contours of these organs in the lungs and out of the lungs. So it is just experience. Here is the image with focal pneumonia, and here the left image is tuberculosis infection, very bad, very danger infection now, which is firstly located in the lungs, and this shadows is the part of lungs filtered with to such place are the pathology tissue in lung tissue. Next is MRI image of the heart and large vessels. This section was done at the level of the cartilage 3, and we can see different vessels. Number 1 is and number 5. This is the aorta, because aorta makes the arch, so it is visible in two. This is a ascending aorta and descending. Number 5 is descending aorta. Number 1 is ascending aorta. You can nicely see the number 4, which is a pulmonary trunk and right pulmonary artery. You also see the superior vena cava here, and some parts of the heart. This is the part of left atrium, and even you see the sinus. This is the cavity between heart and between pericardium. It is located on the below the heart, between column vertebral, between vertebral column. And another MRI projection, this is the oblique sagittal section, which is showed here. You see different chambers, different heart chambers, like number 8 right atrium, number 7 right ventricle, number 9 is left atrium, and of course number 2 is left ventricle. Between atriums we see the arterial septum with a small, I think, a small defect in this structure, which gives the possibility to blood come from the right atrium to the left and back. And you also can nicely see the interventricular septum here. This is mostly the inferior part is consists muscles and is quite thick, but upper part of this I show it's here is the membranosus part of the septum, which is made of the connective tissue, and that is the thin part of the septum. This picture shows us valve's position in frontal section, in frontal examination, X-ray examination, and here is the position of the valves in sagittal projects. As you see, the letters means the different valves. P is pulmonary valves, A is aortic valves, they are semi-lunar valves, and then we distinguish M, mitral valves, and T, tricuspid valves as well. As you see, the tricuspid valves is located is the most inferior located valve. CT of the chest in a horizontal position at the level of the fifth thoracic vertebra shows us different organs of the chest. Usually we see also the aortic, this is a pulmonary trunk, and aortic arch here and here, and also we see the air inside of trachea. Here is visible the air, and you distinguish that the same contrast of lung tissue, and because it contains air, and also air in the trachea. Another structure, I guess you can call and localized as алло. Ну слушайте, ну там кто-то один пришел, вот я ему читаю сейчас, там, ну может быть они начали, потому что опоздали, там никого не было. Я думал уже, я вам позвонил. Ну все нормально. Анна Вальтеровна, ну слушайте, так как мы с вами вот о чем говорили, то и есть, в общем, оно так все и продолжается. Ну, что есть, то есть. Ничего страшного. Я просто не хотел читать лекцию, пока никого не было. Думал, что... вот. Ну так. Ну, они зря так думают, потому что я буду спрашивать обязательно рентгеновские исследования. Это современные методы исследования. Так что... Да ладно, все хорошо. Я зря вам, наверное, написал, просто уже все решилось. Спасибо. Все. Хорошо, все, до свидания. Sorry. I had to talk with Anna Walterovna. And next picture is the inferior level of the section, of horizontal section, and you see also different chambers, heart chambers, and as well as interventricular septum. We have just talked about this structure. and contrasted aortography. Here is a positive. This way show us the dark contrast inside of aorta, especially visible the first part of aorta called bulb of aorta, and the position of the cusps of aortic valves. Here is anterior and left posterior cusps. Here you see the ascending aorta, aortic arch with the three large vessels, number 1, 2, and 3. First is the brachiocephalic artery. Mostly it is a trunk, it is not artery, because this is a trunk, and it is divided in the right subclavian artery and right common carotid artery. Left, then number 2 is left common carotid artery and left subclavian artery as well. Take a look for this structure. That is a catheter which is inside of aorta, and through the catheter the contrast fluid come into these large vessels. Here is the number B is also radiogram, but made by computed tomography. Good picture to show you vessels of the branch of large vessels of aorta. This is the brachiocephalic trunk. This is a correct name. Left common carotid artery and left subclavian artery. As you see, the trunk is divided into the common artery, carotid artery, and right subclavian. All of this interesting. The vessels number 5 and number 8 here. These vessels called vertebral artery. 5 is right artery and 8 is left artery. They pass through the vertebra, cervical vertebra, and come together, join in the brain cavity, and form basilar artery here, which transport the blood to the posterior parts of the brain, like cerebellum and occipital lobes of the human brain. Special contrast examination, doctors use to see surface of the esophagus. Usually they ask patient to swallow the barium sulfate and visible different part. Here number I is upper part, then middle part and lower part of esophagus. Good visible the folds, long folds inside of esophagus, and usually doctors evaluate the surface of the esophagus. And here the pathological process, Schatzkering, this is a narrowing process of the lower part of the esophagus, and you see the barium concentrated before these rings. Usually such people cannot to eat properly, because the food stop in the lower part of the esophagus and couldn't come into the stomach. Here is the diverticulum of the esophagus. This is a small pocket on the left side of the esophagus, which is filled with barium sulfate. And here the left picture is the stenosis, esophageal stenosis after taking acid or some of aggressive fluid. Acid, it may be also the alkaline or some very hard product. Mostly is this chemical stenosis after taking acid inside, and you see that is a narrowing in the middle part of the esophagus, and food also couldn't pass through the esophagus. Abdominal organs. Of course, the most interest is the stomach, because a lot of problems people have with that organs, like the cancer of the stomach, like ulcer of the stomach, and gastritis. It is filled with the barium sulfate, and we distinguish different part of the stomach. Number 1 is the fornix, number 3 is body, then we see the part called Philoric part of the and also good visible the laser curvature and greater curvature of the stomach. You may ask me about these structures. That is just folds, which is the contract of the stomach wall just for evacuation of the fluid from these organs. But number 9 is the sphincter, Philoric sphincter, which allows fluid to come into the duodenum. This is the initial, the first part of the intestinum ternae, duodenum. And we see also the fluid, contrasting fluid inside of the duodenum and even in the jejunum. With the radio examination, we see different part of the stomach, and doctors, X-ray doctors called radiologists, called the superior part of the stomach saccus digestorium, which means digestorium is the saccus, or a pocket for the food pocket, another way, and the inferior part, it calls canal, Egestorius canal, which means evacuation canal, which have a lot of folds, and these muscles evacuate fluid, evacuate food from the stomach. Different variants of the and position and shape of the stomach. With the people normosthenic, they have hook, like a hook for to catch fish. And then stocking shape, usually sometimes something like this. This is the stomach shape for asthenics, and horn shape for the third type of for the body type, for somatotype, called hypersthenics. So it is looks like a horn, really. We use, I don't know what we don't use it anymore, but in some of nations, in some country, people use it just to drink wine. For example, it is for Georgia in the south part of the Europe. Next, I'd like to demonstrate normal comparison. Normal, this is a positive image, and left negative image. Here you see ulcer. This is a defect of the stomach wall, which is filled with the barium. It is danger if such pocket or such sac will perforate and the fluid come into the abdominal cavity. It is very, very danger complication of the ulcer. Here you see stomach cancer. It is like a tissue plus object, because it is not filled with the barium, and it is like some another object which is joined to the stomach wall. And here you see the operated stomach after gastrectomy. Usually surgeons take ectomy, they evacuate, they cut this part of the stomach with the cancer, and then use communication with the intestinum tenue, like here it is visible. That is a iunum joined to the small stomach after gastrectomy. Here is the barium inside of intestinum tenue, showing us the internal surface and different folds of these organs, very long organs. Or it is another picture shows the same organ, but this examination called Irigography is filled when the barium with the barium doctors inject or filled, in other way it's better. Special term is enema, barium enema inside of large intestine, like through the rectum, and barium come this way and filled all parts of the colon. Here we see the cecum, initial part, then colon ascendens, then this is a colon transversum, and colon descendens. The thin part of the colon is colon sigmoid. Here you see this is like Greek letter sigma, which is follow in the rectum. By the way, this method is combined with the barium and air. Some part of large intestine is filled with the air. Some part contain the barium sulfate. This is also X-ray after enema, when barium is evacuated. I hope you guess the way how it is evacuated from colon, from the large intestine. If not, it means you are bad students and you don't know anatomy. So this is just air inside of colon, and good visible all parts. Here the horizontal section CT scan through the liver. This is the thoracic vertebra number 10, and we see also the stomach. Number 20 is spleen, and large organs with the vessels inside. This is of course liver, and it is position. Here is the stomach. Well, the level of the thoracic 11 show us the great vessels, artery, called celiac axis or celiac trunks, which provide blood for most internal organ of the abdominal cavity, the liver as well as intestinum tenui, and large part of colon also. Here number 9 and number 18, this is the kidneys. Number 9 is right kidneys, upper pole, and number 8 is this is upper pole of left kidney. By the way, that is not typical, because the this right kidney should be located lower than left kidney, but we see only upper pole of left kidney and just bigger part of right kidney. It means that this kidney left kidney is moved down a little bit, so a diagnosis is the moved kidney. Here the liver infiltrated with the cancer tumors. Here all of this is metastasis inside of liver. This is another horizontal section CT scan, and the same organs as we just talked before: spleen, left kidney, right kidney. This is the inferior vena cava and abdominal aorta, and of course the lower part of liver. This is the right lobe of liver. Here the pathological process called ascites is fluid inside of abdominal cavity during the portal stenosis, portal hypertension, when after pathological process in liver with liver tissue transformate in connective tissue, and it is not possible the blood come into the liver, so it's come out of veins and fills abdominal cavity. Here is the frontal section. We also see this is a liver, I think you guess, and number 6 is gallbladder, quite big for this position, and this is usually it's a bile inside of this stomach. Especially during the operation, when here should be the gallbladder, but it was evacuated during the operation, and surgeons put the tube inside of bladder duct just to be sure if some of concrement doesn't located in the holidoch, the common part, the biggest part of the biliary tract, and they found the concrement inside, and then they needed to evacuate this concrement because it would make a lot of problem for the operated patients if they stay it in the holidoch. Here is a contrasted mesenteric artery, another angiogram of the inferior mesenteric artery, which bring the blood to the descending colon, sigmoid colon as well, and the upper part of rectum. Here is excretory orography. I explained already how they use it, and it is visible renal pelvis which have different form, right and left kidney, different shape of the pelvis, and ureters with the portion of the urine, and the urine inside of urine bladder. This is also excretory orography in positive, but this is a scissors inside of abdominal cavity. That is left scissors during it was left during surgical operation. And the last part of our lecture is MRI examination, male pelvis in sagittal section. Here visible urinary bladder, number 1, prostate, number 4, and rectum. This is the male pelvis. As I guess, this is I guess you understand what this structure means. Here also male pelvis with a horizontal section. We see the bladder here, and also visible the pelvic bones. This is, I think, that is ischial bones or ischium, and sacrum or sacrum here. Nothing more interesting. And the inferior level, more inferior level, with the rectum, and between rectum and bladder are the seminal vesicle, left and right. And you see also the articular, the joint with the acetabulum and femoral head. Female pelvis. There are three organs in the pelvis: bladder, uterus, and this is uterus, and rectum, number 11. But the lower part, this is vagin and external female organs. Here is the same organs in horizontal section as MRI examination, with the cavity, and rectum. Between uterus and behind of rectum, located or sacrum. And special examination with injection contrast inside of come through and pass the fallopian tubes and show doctors if it is empty, if it is possible when ovarian come through this way, because it is natural way of spermatozoos and ovarium. Here angiogram of iliac arteries. This is aorta, two common iliac artery, and they divided into the internal and external iliac arteries. And this is foreign objects inside, or foreign bodies in the pelvic. This is a special metal subject inside of pelvic, and this is even cell phone. I hope you guess the way this object came into the pelvis. Thank you for your attention, and now I am open for your questions. Let me see. Does this X-ray have any side effects on the brain, or could that radiation have side effects? Good questions. I say that modern X-ray examination has very low radiation. It is no danger than you take flights from one city to another city, from one airport, because when the Airbus or Boeing come take 10,000 meters, the radiation from the space is the same like X-ray examination now. Another questions, some chemical have effect on the picture ray. For example, if the patient use a certain medication on, could I have an effect on the I would say that barium sulfate has no impact of the internal organs, because it is absolutely not diluted in water and not possible to take inside of blood vessels and take inside. It is just transport through the whole digestive tract without coming in the organism. Any population. It is the same question. I have already answered it. What is a common occupation hazards associated with performing medical imaging procedure? The most danger is fluoroscopy, because doctor need a long time just to see organs, and patient may takes more radiation than during the only X-ray examination during CT scan. And I absolutely sure for now it is not improved danger of MRI examination. Okay, so the last thing I'd like to tell you today, it is the announcement about test you have passed through, and this test is located in the Moodle. You will find it. The test will be open till 19:30 today, and I hope you will find it interesting. Let you goodbye, and as far as I know, you have first exam in the beginning of October, and I wish you good luck in exam and hope to see you in the next autumn semester after the 1st November. Today with you was your professor Starchik Dmitry Anatolievich, and let me wish you again everything the best and good weekends. Thank you, and see you again in the November. Bye bye, my friend.